All right, guys, so now our patient is done with all their IV therapy and it's time for us to DC their IV. This is probably the easiest thing that we do other than getting tape off of arm hair because that's really painful and uncomfortable. All right, so what we're gonna do, we're gonna put on gloves because we are gonna come into contact with something that is sticky, wet, and not ours. So we want our gloves on. We're gonna talk to our patient about the procedure. Jane, we're gonna take out your IV now so that you can get ready to go home. What we might do is if they have a lot of arm hair, you might want to use alcohol to kind of break up the tegaderm. And it kind of goes through and breaks up some of the adhesive. Sometimes it works great, sometimes it doesn't. So it really depends. So we're going to kind of pull up all of this. Okay, and you can see it kind of coming up. And what I do is you see my one hand is stabilizing that catheter and my other hand is the one pulling the tape. And I like to stick the tape onto itself so that it doesn't re-stick to them because it doesn't do a whole lot of help if it's sticking back to them. Okay, and so we're going to keep kind of pulling and working it off. Again, stabilizing that because we don't want to accidentally pull it out. Then with some little cotton or gauze or whatever you've got, we're going to go ahead and put it here and pull it straight out. The biggest thing that we want to do after we pull it out is we want to hold pressure, okay? And then we also want to take that time to look at our catheter tip to make sure that we got all the pieces out because sometimes the needle can go through the tubing or something like that and cause other holes or cause bends and kinks. So it's always nice to pull it out to make sure that we have all of the catheter intact. Then we're gonna, if it's still bleeding and they want to, we're gonna keep that gauze on there, keep some pressure on there. And just put some tape. And then this part, depending on your facility policy, sometimes this gets thrown in the sharps container. Sometimes it just gets wrapped up in your glove because it's like a straw and it's not really a sharp. So it really depends on what your facility wants you to do. And that's how we DC an IV.